My name is Dr. Lakhan Kashyap. I am a medical oncologist and I practice at Manipal Hospital, Pune. And I have been practicing as a medical oncologist for past 5 years.
So, what are the early signs and symptoms of the lung cancer?
The lung cancer, if we see, there are certain signs which usually overlaps with the some of the benign or what we see kind of a routine diseases such as cough, if a cough is present and if that cough is prolonged, if it is lasting for more than 2 weeks, it should not be ignored. And if cough is associated with some red flag sign, and that red flag sign could be blood in the sputum, or it could be weight loss, it could be loss of appetite, persistent chest pain. So that these are the red flag signs which shows that there is something which is more nefarious, and therefore it should be evaluated early. Apart from that, if there is someone who has a risk factor for lung cancer, for example, if someone who has a long history of smoking 20-25 years, and that person develops kind of a weight loss or backache, that should also be evaluated early because that could be sign of a advanced lung cancer.
So, at what age screening should be ideally done?
So, if we ask screening for the lung cancer, there is a no universal screening recommendation as such. If we see the data to support that is only for the persons who have been smoking for quite long time. So there has been some data that the persons who have at least smoked for 20 pack years, they are at a high risk of lung cancer. And in those persons, a low dose CT scan of the lung can be done as a part of the screening. However, apart from that smoking, we have a other risk factor for lung also. If we see that nowadays there is a lot of rise in pollution, so that also contribute to some lung cancers. These particularly the lung cancers which arises in non-smoker. So it is difficult to say whether they will benefit from screening or not. So apart from the screening, those screening should be done in those patients. It is important that people should be vigilant about these symptoms also.
और ये स्क्रीनिंग कितने इफेक्टिव है सर लंग कैंसर को डिटेक्ट करने में?
दो ये जो लंग स्क्रीनिंग है, जो हाई रिस्क ग्रुप रहता है, इसमें इफेक्टिव है। अगर हम जो स्टडीज है उस पर जाए तो उनके हिसाब से लगभग ये मैक्सिमम जो कैंसर के केसेस में डायग्नोस होते हैं वो अर्ली अर्ली स्टेज में ही डायग्नोस होते हैं, जहाँ पे वो बहुत छोटे होते हैं जिसको आसानी से ट्रीट किया जा सकता है। बट इनमें कुछ प्रोपोर्शन या फिर कहेंगे कुछ मतलब कुछ पेशेंट्स रहेंगे, कुछ पर्सन जिनमें वो फॉल्स पॉजिटिव होगा। फॉर एग्जाम्पल जहाँ पे मतलब होता है कि वो कुछ दिख रहा है बट उसमें कैंसर नहीं हुआ, कुछ और चीज़ हो सकती है, ये चीज़ें भी रहती है। तो मोटा मोटी तौर पे कह सकते हैं कि हम ये जिन हाई रिस्क पेशेंट्स में लगभग 80 से 85% तक ये इफेक्टिव रहता है डिटेक्ट करने में।
So, what delays you see in your patients from your reason?
So I practice in western part of the country. So there also it's same only. It sometimes because of the symptoms, as I told you that they overlap with some of the benign things such as routine, some viral infections. So sometimes patients just ignore them that it may not be lung cancer. So it leads to a delay in the diagnosis and they present at advanced stage. And particularly in the non-smoker, if we see the pattern of the presentation in smoker and non-smoker, smoker tend to have the tumor which is centrally located, which tend to produce symptoms quite early. But non-smokers, they have a tumor which is placed at the periphery, or we can say at the near the chest wall. So there the symptoms doesn't arise unless it is the tumor size is quite large. So it is an irony that non-smoker present when they present, they have been having this cancer for quite long time. They present with advanced disease only.
Role of tobacco in lung cancer?
So tobacco, definitely it is one of the important risk factor. So if we see the smoking tobacco, it is completely directly linked with the cancer. If we see that if someone is smoking and smoking consistently for a long period of time, that person is exposed to a lot of carcinogens which is there in the smoke, and it causes lung cancer. And tobacco in other form, though not directly, but it causes the risk of other associated cancers which may be oral cavity or the head and neck cancer.
So, how do you decide between systematic therapy, which is like chemotherapy, targeted therapy, while treating lung cancer?
So whenever we have a patient of lung cancer and we establish the diagnosis via biopsy, we do a a kind of a molecular test in that biopsy specimen to identify whether there is some kind of changes which is present or not in that lung cancer. There are certain changes, there are certain genes which drive this lung cancer, and whether there are mutations or changes present in those genes. If this is present in those genes, for example, if there is a EGFR mutation or ALK rearrangements, we have a very good oral targeted treatment for that, which provides a very good response to that treatment for that patient. If it is not present, and then we do certain tests to see if the immunotherapy will work or not, and then we combine it with chemotherapy. There are some instances where we can combine chemo and targeted therapy also.
How much people, in your experience, how much people are aware of the surgical treatments, like especially the less invasive ones?
So if you ask me that, maybe one fourth, 20-25% who I see in the practice, most of the patients, they are not aware of the advances in the surgical treatment which has happened over these years in lung cancer. Particularly if we see, maybe way back 10 to 15 years, 15-20 years back, the treatment used to be where the very large portion of the lung need to be removed. It has to be done through open surgery. Now there has been advances in robotic surgery, the keyhole surgery, and that a smaller portion of the lung can be removed. So all this thing has helped in early recovery and delay and the less number of complications. So definitely awareness is increasing, but still a lot of patients are not aware regarding that.
Small cell lung cancer or non-small cell lung cancer क्या है?
सो इफ वी सी लंग कैंसर, सो दे ब्रॉडली ऑफ टू टाइप्स, दो तरीके के रहते हैं. सो जब भी हम देखेंगे तो नॉन स्मॉल सेल एंटायरली डिफरेंट वे में ट्रीट होते हैं. जो लंग कैंसर हम कहते हैं कि जो सबसे अग्रेसिव वेरिएंट का होता है, दैट इज स्मॉल सेल लंग कैंसर. बट स्मॉल सेल लंग कैंसर अगर देखा जाए तो वो 5 to 10% ही होते हैं जितने भी लंग कैंसर पेशेंट्स हम डायग्नोज करते हैं. 90% जो पेशेंट्स होते हैं, दीज आर नॉन स्मॉल सेल लंग कैंसर. स्मॉल सेल लंग कैंसर प्रीडोमिनेंटली अगर हम कहें तो 90-95% उन पेशेंट्स में ही होता है जिनको बहुत ही लॉन्ग स्मोकिंग हिस्ट्री रहती है. नॉन स्मॉल सेल दोनों में ही हो सकता है. स्मॉल सेल में अगर वो अर्ली भी रहता है तो प्रीडोमिनेंट ट्रीटमेंट इज रेडिएशन एंड कीमोथेरेपी. नॉन स्मॉल सेल कैन बी ट्रीटेड विद सर्जरी आल्सो.
दोनों दोनों के ट्रीटमेंट ऑप्शंस भी अलग
Yes, yes, it is different.
Then how do you address the quality of life after treatment of the lung cancer?
So it is a very important aspect because once you treat a patient is free of disease. Now there is a lot of thing which has happened because of this treatment. अब ऐसा रहता है कि ये ट्रीटमेंट की वजह से उनका जो फंक्शनल कैपेसिटी होता है, उनका फिजिकल अपीयरेंस होता है, ये सारी चीज़ें अफेक्ट होती है. उनका इमोशनल स्टेटस, साइकोलॉजिकल स्टेटस, ये सब कुछ अफेक्ट होता है. तो ये सभी चीज़ों में पेशेंट को कुछ सपोर्ट चाहिए होता है ताकि वो रिहेबिलिटेट हो पाए. फिजिकली उनके बेसिकली कुछ एक्सरसाइजेस, थोड़ा लंग के एक्सरसाइजेस ऐसे, ताकि देख दो उनका काम 100% तो नहीं एटलीस्ट, लेकिन वो 70-80% जितना पहले कर पाते थे उस लेवल तक पहुंच पाए. इमोशनली साइकोलॉजिकल सपोर्ट चाहिए रहता है ताकि दे विल बी एबल टू फंक्शन प्रॉपरली इन देयर होम, इन सोसाइटी एंड ऑल्सो इन देयर वर्क प्लेस. ये सारी चीज़ों का सपोर्ट चाहिए होता है एंड ग्रेजुअली वो फिर धीरे धीरे करके जो अपना नॉर्मल लाइफ है उसमें आ पाते हैं.
What one thing every caregiver should understand about the lung cancer?
So, because see, the caregiver's role is very important in any treatment, in any cancer, lung cancer, it is definitely very important. They should understand that they are there for their patient. They they are caring for for their patient, but definitely they have to be be actively involved in their care. Listen to the doctor's advice, and just make that they follow up or during the treatment, and after that, that is adhered to, because it is one of the important part of the treatment.
Any last message for your patients?
So see, now the treatment diagnosis of the lung cancer has changed a lot. So we should not fear of it. And if any kind of a symptoms which is there, I mean, which you see that it has been there, for example, cough, which is for a long period of time, don't ignore it. Come forward with that particular symptoms to your doctor. Talk with your doctors. We have a very good treatment, and lung cancer is definitely treatable. Though it is curable in a few patients, but in majority of the patient we can treat it and we can provide a very good quality of life to those patients.